Hi, Catherine. I just realized that I'm going to do the meniscus test to see if there's any, or which is also known as a Thessaly test. I hope I'm pronouncing that right. But I noticed in my first video with respect to the valgus and the varistress test for the MCL and the LCL, I just did it on the client's left knee, or sorry, the left knee, but ultimately you're supposed to do them on both. So I just did them on one, but I just wanted to say that doing that when you're doing that with a client, um, well, I just learned something. Obviously, when you're doing that with a patient that's an injured, she was most likely just going to, he or she will probably most likely just have an injury on one knee at a time. If they have injuries at both knees at a time, then they would have to deal with that accordingly. And um, I know you didn't want anything to do with the EAP, the Emergency Action Plan, but I think what's important for to mention is that it is important that I think if I was a coach, that if I was able to do that and assess my client's potential injury, that may or may not be a good thing because that's maybe out of my breadth or depth of expertise. So I may not do that, but just for the purpose of this test, I'm learning that, and it's good to know. But again, I would just follow I would contact EMS right away, and then as a trainer, I think my job would probably be more along the lines of following the rehab prescription from the specific um, healthcare providers. Okay, so now we're doing the meniscus test, and this is the same guy that I'm doing the test on. Okay, Christian, say hi, Christian.
Hey,
Okay, so basically what I'm going to do is this client's going to bend his knee about 20 degrees inwards, okay? And then he's just going to twist it to the left and then to the right and back again, okay? And so he does that about 3 or 4 times. And then if he doesn't feel any pain, okay, in that movement, or if he has what's called a locked knee, okay, then that should be sufficient. That there's no damage to either to his meniscus in his knee. Okay, so hopefully that'll be okay. And yeah, I'll see you I guess next week when I do my SI joint. Take care. Bye bye.